Hello, everyone. We're going to do a session using Scribe. David Scribe. Patient is post-knee replacement. So I click AI Scribe. I choose case. We're doing a new validation node. All right. In terms of service, my first time using the Scribe on this account. Sign it. I'm agreeing to it. Confirming. Hi, David. I'm your physical therapist. How are you feeling today?
I'm doing okay, actually. A little stiff, especially around the knee, but I'm really glad to be here and get checked out.
How's your knee?
Yeah, so it's been a bit sore, especially when I try to bend it. Walking is a bit easier with the crutches, but I still have a little pain.
Oh, that's very common at this stage. On a scale of 0 to 10, how would you rate your pain right now?
I'd say it's about a 4 right now. It's manageable, but I can definitely feel it, especially when I try to straighten the knee fully.
Makes sense. And when did you have your surgery?
I had the surgery about 2.5 weeks ago, so I guess this is right in that early recovery phase, right?
Yes, it is. And it says here you have diabetes and hypertension as well.
That's you. I've been both for a few years now, so I need to keep an eye on my blood pressure and blood sugar as we go.
Yeah. And what activity is the most difficult for you right now?
Mostly, it's just getting in and out of chairs and walking longer distances. I'm also a bit nervous about going downstairs, so balancing feels tricky.
And how many minutes can you walk for?
I'd say I can do about 5 to 10 minutes before I need to take a break. It's not super far yet, but I don't want to overdo it.
Okay, and are you using anything like a cane or crutches?
Yeah, I'm still using crutches most of the time, especially when I'm moving around the house or going to the bathroom. I just keep them handy.
Sounds good. All right, so we'll work toward progressing you safely. So have you noticed any swelling?
Yeah. Especially by the end of the day. I've been trying to ice it as much as I can.
That's good. You should do that. Okay, I'm going to take a look at your knee. Let me know if anything feels uncomfortable.
All right, sounds good. I'll let you know if anything feels sharp or if the range of motion's off.
Okay, I see some swelling around the knee. The incision looks like it's healing well. I'm going to gently bend your knee. Tell me when it feels tight or painful.
Okay, it's a little tight right now as you bend it. I'd say I feel it at about 45 degrees, so maybe we just slow down a bit.
Yeah, that's about 50 degrees flexion. We'll look on improving that. Now check how straight you can get your knee. Okay.
All right.
It doesn't fully straighten yet.
Yeah, I can feel that. It still has a little bit of a bend at the top, maybe around 10 degrees. I'll keep working on it slowly.
Yeah, your bend is more like 20. That's fine. I see a slight limitation there. That's also normal during this stage of recovery.
Can you use gentle range of motion exercises, and I'll check in with you again in a few days. Sound good?
Okay, that's expected with the surgery. Okay, your quadriceps need to regain strength, so we'll focus on working on your quadriceps. I'm gonna actually go into watch you walk a few steps with a walker.
Let you know how it feels as I move. I'll keep it slow and steady.
Okay, I see you putting less weight on your right leg and taking shorter steps. We'll work on improving your gait pattern.
Yeah, exactly. I'm really focusing on not favoring that left knee, so I'll keep practicing and we'll build up from here.
And what are your goals in therapy?
I really want to get back to walking independently without any assistive devices, and eventually I'd love to get back to some light hiking. So I'm really aiming for that longer term mobility.
Sounds good. Sounds good. Those are great goals, and based on today's evaluation, we'll focus on improving your range of motion, strength, walking, and overall function to get you back to hiking and your leisure activities.
Yeah, that sounds perfect. Appreciate the plan. I'll stick to the home exercises and I'll see you next session.
Yes, but I have to go over a home exercise program for you as well.
I'll take notes so I can keep up with them at home.
Yeah, here's your printout. Okay, we're also going to send you a link with your exercises. You're going to do some in supine, which is laying down facing the ceiling, right? You're also going to do some in sitting and standing. Okay, so in general, I expect to spend anywhere from 45 minutes to an hour at least. All right, and you're going to come to therapy probably 3 times a week. Okay.
Plan. I'll be here Monday, Wednesday, and Friday, and I'll make sure I do the home exercises on the off days.
Yeah, if you have any questions, contact us. Okay, you could call us or text us, and we'll be able to assist you.
Perfect. I really appreciate that. I'll keep track of everything, and if anything comes up, I'll reach out. Thanks so much.
Thank you.
You're very welcome.
All right, so that concludes my assessment. All right, so now I'm gonna click stop and generate note. It takes a few seconds to process. So you can see the circle spinning. If you're a busy clinician and you're moving between patients, you could always save it as a draft and come back later. But again, it was a long session, so it doesn't take that long to finalize it. It gives me a transcript. It's generating a clinical note now. So while it's saving, you could actually take a look. Most of the conversation is pretty accurate here. Yeah, very good. And then we could click save as a draft. Okay. So it took you, and this is here in the notes. Right, so this is the notes case. As you could see here, 5/22/2026, today's date. Processing from AI Scribe. Okay, it's still processing. Look, that circle indicates the AI Scribe generated this note. The blue check mark means it's in draft. I'm gonna click view and edit. Okay. Let's see what we have. So we have the date, surgery date. The patient mentioned that was 2.5 weeks ago, which is pretty accurate. We have ICD-10 codes already inputted. They could be edited, right? We have past medical history, durable medical equipment, right? Reason for referral. Pretty comprehensive. All right, click next. Functional deficits. We have the freehand box here. Pretty accurate here as well. The ambulation tolerance limited to 5 to 10 minutes. And you could manually still put in information in the drop downs, mobility gait, weight bearing status, etc. The next tab here, we have the knee edema documented really well. We have pain here as well, right? No objective tests were performed, so they're not documented here. And we have objective comments box filled out, right? Very neat, has all the information that was discussed with the patient here. Let's look at the treatment plan. So we have short-term goals, long-term goals. Very good. Filled in the goals, and those could be still edited now. We have CPT codes. Again, those could be edited as well, but it's pretty accurate. Number of weeks, but 12 based on the long-term goals. Okay. Yeah, the assessment looks good. Beautiful. And even have the treatment already documented as well. Very good. And we could still save it as a draft, close it, and finish it later. Enjoy the scribe.